All right, let's go ahead and knock out the last lecture of our class. So we talked about root operations for the medical surgical section, and this week we're going to look at root operations for the med-surg section, and then the ancillary section, but they're called root types because we're not really doing operations. All right, so first section, obstetrics. So I've put the section number here at the top, and then this is the character that's associated with the root operation or root type. So in the obstetrics section, there's actually 12 root operations. There's only 2 that are unique to this section. The other 10 actually come out of Med-Surg, so I'm not going to review those again. So our unique ones to the obstetrics section, we have abortion, artificially terminating a pregnancy, and then delivery, assisting the passage of the products of conception from the genital canal. And something that, I don't know, just might seem a little off here. So a cesarean section, if we really look at the definition of the root operation of delivery, it doesn't actually fit. So when they do a cesarean section, it's actually extraction for the root operation. So an example here could be like a manually assisted spontaneous abortion would qualify under delivery. Placement is our next section. So here, these are only procedures that are performed without making an incision or puncture. So if they are making an incision or puncture, then we'd fall under the med-surg section instead. So we have, I believe, 7 different root operations here. We have change, taking out or off a device from a body region and putting it back in an identical or similar device in the same body region without cutting or puncturing the skin or mucous membrane. Compression, we're putting pressure on a body region. Dressing, we're putting material on a body region for protection. Immobilization is limiting or preventing motion of a body region. Packing, putting material in a body region. Removal, taking out or off a device from a body region. And traction, exerting a pulling force on a body region in a distal direction. So some examples here, we might have packing material in the ear, we could have mechanical traction of the leg, removing a splint, placement of a neck brace, changing out a pressure dressing, etc. Administration is section 3. We have three root operations here. We have introduction, putting in or on a therapeutic, diagnostic, nutritional, physiological, or prophylactic substance except blood or blood products. Irrigation, putting in or on a cleansing substance, and transfusion, putting in blood or blood products. So basically, if they're doing anything with the blood, it's going to be transfusion. If it's a cleansing substance, it's going to be irrigation, and then everything else falls under introduction. So some examples here could be peritoneal dialysis. We could have irrigation of a knee joint, epidural injection for pain control, etc. Measuring and monitoring, here we have 2 root operations, measuring and monitoring. So measurement, we're determining the level of a physiological or physical function at one point. So this is one single level. Monitoring, we're doing the same thing, but we're looking at it over a period of time, so we have a series of levels that are being checked. And our 6th character here is a little bit different than it is with our med-surg. We're defining the physiological or physical function being tested. So some examples here, we could have a cardiac stress test with a single measurement. We could have fetal heart rate monitoring, something like that. Holter monitoring is another example. Our extracorporeal assistance and performance in section 5. Here we're looking at, it could be things that would happen like in critical care, like mechanical ventilation or cardioversion, or it could be things like hemodialysis or hyperbaric oxygen treatment. And this one, again, our 5th and 6th characters are a little bit different than what we've seen. The 5th character is for duration, and then the 6th character is for function. So our 3 root operations we see here, we have assistance, taking over a portion of a physiological function by extracorporeal means, and then performance we're completely taking over. So key difference there, assistance is just a portion of it, performance we're taking over the whole thing. And then restoration, we're attempting to return a physiological function back to its original state. So this could be things like external cardioversion or defibrillation. Some other examples in this section, we could be doing, again, like the mechanical ventilation, we could have a compression boot with intermittent inflation. Extracorporeal therapies, this is section 6. With these, our seventh character identifies the blood components, and we do actually have several root operations here. So atmospheric control, extracorporeal control of atmospheric pressure and composition, decompression, we're eliminating undissolved gas from body fluids, electromagnetic therapy, we're using electromagnetic rays, hyperthermia, we're trying to raise that body temperature. If they're doing this for cancer treatment, that actually falls under radiation oncology. Hypothermia, we're lowering that body temperature. Phoresis, we're looking at separation of blood products. Phototherapy, we're using some sort of light rays. And ultrasound therapy, we're using ultrasound. So some examples here, we could be looking at like Billy light therapy, shockwave therapy, plasmapheresis is another example, electromagnetic stimulation for urinary incontinence. Osteopathic, section 7. The body systems are really just more general anatomical regions, and our only root operation here is treatment, which is manual treatment to eliminate or alleviate somatic dysfunction and related disorders. Other procedures, section 8. Kind of a hodgepodge section, I suppose. It's methodologies which attempt to remediate or cure a disorder or disease. So some examples here would be acupuncture, meditation, in vitro fertilization. And then the last section out of our Med-Surg-Related section is section 9 for chiropractic. Looks kind of similar to the osteopathic section. Again, our body system is categorized by general anatomical regions, and the root operation here is manipulation, which is a manual procedure that involves a directed thrust to move a joint past the physiological range of motion without exceeding the anatomical limit. All right, now we're to the ancillary section. Again, these are called root types instead of root operations. Our imaging, section B, we have several root types here. And with these, you'll see different characters as well, different than our Med-Surg section. So our third character in the imaging section is, again, root type instead of root operation. The fifth character defines contrast. The sixth character is a qualifier, which specifies if an image is taken without contrast, followed by one with contrast. And then the seventh character is again a qualifier, but it's not actually specified in this section, so we won't really see any values there. Alright, so our root types, we have plane radiography, so planar display of an image developed from the capture of external ionizing radiation on photographic or photoconductive plate. This is what we generally think of as an X-ray. Fluoroscopy, we're using a fluorescent screen in that case. CT scan, we have MRI, we have ultrasonography. I'm going to get into the definitions of these. We have I went a little bit past the imaging. I wanted to give just some examples here. So we could have like a non-contrast CT of abdomen and pelvis. We could have a fetal ultrasound. We could have fluoroscopic guidance for an angioplasty. All right, our next section is nuclear medicine, section C. Here the fifth character specifies the radionuclide, or the radiation source that's used. And then again, your sixth and seventh characters are qualifiers. In this section, neither of those are used, so you end up with ZZ at the end of all of your codes. So here we have planar nuclear medicine imaging, we have the tomo scans, the PET scans, we have non-imaging nuclear medicine uptake, probe, and assay, and then we have systemic nuclear medicine therapy. So some examples here are a lot of things that are really hard to pronounce. Tomo scan of the right and left heart. We have a uniplanar scan of the spine, PET scan of the myocardium, etc. Section D is radiation oncology. These don't have specific definitions according to ICD-10, so I assume we're just using the the normal medical definition of these. We have beam radiation, brachytherapy, stereotactic radiosurgery, and then we kind of have this other category. So this could be like plaque radiation of the left eye, we could have brachytherapy in the prostate, contact radiation of tongue. Section F is physical rehabilitation and diagnostic audiology. There are several root types in here. Again, I'm not going to get too specific in terms of these definitions. In terms of our characters, the second character is a section qualifier, and it specifies if it's rehab or diagnostic audiology. The third character then is going to be that root type. Fourth character is the body system and the body region. They are actually combined typically. Fifth character is the specified procedure type, and then the sixth character specifies any sort of equipment that's used. So this includes things like speech assessment, motor or nerve function assessment, activities of daily living assessment, hearing assessment, hearing aid assessment, vestibular assessment, speech treatment, motor treatment, activities of daily living treatment, hearing treatment, hearing aid treatment, vestibular treatment, device fitting, and caregiver training. The mental health section, which is section G, and this one, our third character, describes the mental health procedure root type. The fourth character is the procedure type, and then second, fifth, sixth, and seventh don't really have specific information, so we have a lot of Z's in these codes. Again, these ones don't have specific definitions. I'm not sure if those are going to be coming or if they're, again, just using kind of industry standards here. So we have psychological tests, crisis intervention, individual psychotherapy, counseling, family psychotherapy, electroconvulsive therapy, biofeedback training, hypnosis, narcosynthesis, group therapy, and light therapy. And then our last section, section H, is substance abuse treatment. Again, our characters are a little bit different. We're using root types. The fourth character is just further classifies that root type. And then again, we have a lot of Z's because a lot of the other characters aren't even being used yet. So we have detoxification services, individual counseling, group counseling, individual psychotherapy, family counseling, medication management, and pharmacotherapy.